Italiano, yes. Okay.
Should I start? Okay.
We can start.
So today we have with us Dr. Lamberto from Italy, who's basically an ozone therapist, and we would ask him a couple of questions regarding the therapy, which is entirely a new intervention in the field of medical education. Yeah?
Yes, just one thing, if I can. Yes, my ozone therapist really is not my first specialty, because I'm a professor of pharmacology, medical doctor, and I teach clinical pharmacology in the University of Ancona. And about 20 years ago I started to be interested by this new approach that increased so far in the last years, and is very important for a lot of ailments, and there's there a lot of interest all over the world. But I suppose that you have some questions for me, okay? Thank you.
So, first of all, I would ask you to brief us something on ozone therapy, like what exactly it is and how does it work?
Yes, ozone therapy basically is a natural therapy. It's simply based upon the administration of a gas. So this molecular, ozone molecule, is quite similar to oxygen. So we breathe oxygen, we live, and we dead, because oxygen is a strong oxidant. And ozone is another oxidant. And just coming back in the last century, at the beginning of the century in Germany, they started to do some observation about the potential activity of this gas. And the idea was this gas, that is a very strong oxidant, so at high concentration can kill bacteria, viruses, and were used after the First Mondial War in Germany. At low concentration can be very useful to induce in our body an antioxidant response. So this information, this first observation, fit very well with the potential activity in the medical field of this gas, because this gas was being used before for pain, and after in aesthetic problem, so for reducing the damage of the aging. So some situation very far by a pharmacological point of view, but for the fact that it was demonstrated that this activity of the ozone is an antioxidant response, we can understand, because usually oxidative stress is at the basis of a lot of problems. So now studies are going on to demonstrate also at clinical level, but now we have a lot of observation all over the world, and this is for me the first time in India, but I know that in this country they already started with ozone, only addressed to back pain. That is only a few parts. So I usually I receive invitation from many society all over the world. Last ones in Chile last year, and I will be in United States in Denver in the next May, and usually I was invited in Dubai. So are there many countries now that's growing the interest, because really ozone is what is magic now is very important, is that we have a lot of problem by an economic point of view. So ozone is really very cheaper, and I don't want to mean that can absolutely be over the normal, the orthodox therapy. We need medicine, we need surgery, but sure, ozone in this phase can help us, can help the body to reduce side effects, for example, to reduce the damage of the aging, and if you look forward, sure we can have back a lot of resources, also by economic point of view, not only by the well-being of the people, because ozone is without any side effects, practically, being simply a gas, and when it is administered at very low concentration.
So this therapy brings along a lot of benefits for us.
Could be, yes. The only side effects,
economically as well as...
Absolutely.
Yeah.
Yes, yeah. The only side effects that you can have that does not work in a very few cases, because really sometimes we have 80% of success rate in many ailments. So I suppose that really it will be a very challenging for us.
So have you conducted certain experiments on some people?
Sure.
Organisms.
If you can see my CV, I reported all all the data concerning the last reports, because my life of scientist is divided into parts. The first part was by pharmacologist, so I have my research conducted in some medicine. Now the last part, the last 20 years in these fields. And we published different papers regarding pain, the mechanism of pain, and how pain is reduced with ozone. Now is in progress one randomized clinical study, because what we need really is to demonstrate to the science that we have that some data that could be well fit the methodology that all the government require for medicine. So we need statistics, we need to demonstrate scientifically that ozone works. So this kind of clinical studies are so far in progress. We need time because we do not have sponsor. So the problem is that if you want to set up a study with a huge population that we need to reach a good level of statistics, we need sponsor. And now, as I told you before, the economic crisis at mondial level could be really very allied to this hypothesis. And we hope that in the future we can start with very big studies.
Okay, so can you tell us something about the scope of this use of ozone therapy?
So the scope, what do you mean for the scope? For which kind?
The possible medical areas, diseases where it can be used.
So I suppose that the wide medical area is the elderly. So in the elderly, we know that the population all over the world is going to increase. So the expectancy for life is increasing. This does mean that we have a lot of pathologies related to the elderly. So I'm talking about the most wide, not the most important, because we have also some rare illnesses that we can treat with ozone. But now I would like to focus my opinion in this, because the elderly really will be a very, very big problem. Not because, okay, we are really very happy to live more, but we would live with quality. It's not important to live 90 years, it's important to live in quality. So we know that for this age we have a lot of problem of arthrosis, arthritis, pain, and usually we spend a lot of money in terms of medicine, in terms of surgery, in terms of hospitalization. So in this context, I suppose it is the main topic in which we must look for the future, because really could be very, very important, not only for the medical possibilities, but by also for the government that there are increases in this period. So this is the main, but we have a lot of other. So the scope of to study deeply ozone, really, for example, we have some rare illnesses that so far are orphan. So we do not have medicine for this kind of treatment. So why we don't try to do some studies addressed to this? Because, for example, in the sclerosis we know that is there a problem on the motor neuron, and is there an antioxidant enzymes does not work, superoxide dismutases. So, and we know, we demonstrated that small, low ozone doses can induce an increase of genetic expression of this enzyme.
Okay,
So
it
it
stimulates the enzyme.
yes, it could be possible that we have the knowledge relating the molecular events. We don't know now how can we fit this with clinic, but we can. This could be really a big chance also for these rare illnesses.
Okay. So can you tell us about your experience of treating patients with Italy and elsewhere?
So this is I have my own clinic in Italy now, and I have another clinic also in Dubai, where I was invited about 10 years ago. They invited me there to try to treat patients. So what I can say, by a scientific point of view, I am a scientist, so I must to test and to clarify by a scientific point of view. On the other way, I have a lot of patients. I treat 1,000 patients that pay each day. They are satisfied without any side effects. In 20 years, I treated almost 10,000 one correct problem. I agree with this problem because I am a scientist, is that we have only few data. We have only a few data, scientific data, so sometimes the oppositors of this, the strong oppositors of this therapy, because we have a lot of strong oppositors, and I don't think that it's correct to opposite before know exactly how ozone works. So I put my life, I put my knowledge as scientist to try to discover, with a big risk at the beginning, because many colleagues of mine told me, Lamberto, ozone is not interesting by a commercial point of view. So ozone is free of charge. So it's very difficult to fight.
But anything which is new in business, it obviously does take
Yes,
some
this
time.
will be a business, but a business, I don't like, who knows me very well, I like people, so I tell to my patients, before treat the patient, you must love the patients. So if any medical doctors, before come back to the Hippocratic oath, Hippocrates tell us, please love the patients, talk with the patients, and give less damage to the patients. So for this reason, we must look positively to any kind of resources. It is really very absurd to oppose it without knowing it, just simply because we don't think that don't fit some marketing options. I don't want to say this, but it's normal. And now,
Even from a marketing perspective, the trial is always very important.
Yes, because I suppose that could be also a business, other than a very beautiful thing for all the people suffering. Could be a business not only for the medical doctors, not only for the health authorities, but also for the government and for the people. So I think that this is the time, the right time.
And what do you think is the scope of ozone therapy's use and commercialization in a country like India with a large population, poor medical facilities, and where there is already a strong culture of alternative medical therapies?
So this is, who knows me knows that when I speak of one thing, I tell what I have in my mind. And not because I am in your country, but really, India was the first country about 10 years ago that reduced the possibility to produce different specialties from one active ingredient. And this is a beautiful thing. Because if we have one active ingredient, we must put on the market only one specialist to avoid confusion. But one of the last was the fight with Novartis. No? It's very recent. India, that make possible to all the people. You have a lot of population. We have a lot of problems all over the world, not only here. So it's correct to try to help all the people. We can imagine, we can introduce ozone therapy. Could be really very useful for all. I don't want to talk about business, but the people will be healthy, will be happy, with less side effects, and hoping to live more than 90 years, but I don't know if I speak too much, probably not. I hope to be interesting.
Yeah. Any last words that you would like to share with our audience watching this video?
What? To share? Sorry,
Any last words that you would like to share with us?
I suppose that yes, I am happy to be here. Really, I love it. This is the first time, but I was very happy because before coming here to my patients in Italy told me, come back, doctors, please, come back, because they are afraid every time that when I am invited all over the world. And I told to my patients, yes, really, I was invited in all the countries all over the world. 2 more countries never invited me. The first one was India, and the second one China. So now remain China, but I know that in China there is a big progress in the field. And perhaps China will be perhaps one of the first countries to legalize. Now we have two countries, Cuba and Russia, and also in Italy we can work, but it's not recognized so far. Also they tell to the medical doctors, okay, you can work in ozone before, but it's not really very well recognized, so this is another problem, because if it's not recognized, you can have a lot of medical doctors treating patients with ozone without knowing exactly how ozone works, and this is a problem. So China coming back, but I am happy to be here in India, and I hope that this small vacation and meeting with your people, also for treating people, could be an auspicious for the future. I hope so. Thank you very much.
Thank you.
Thank you.
You're welcome.